Ever wonder why some women face extra barriers in healthcare, not just because of cancer, but because of who they are? The answer is intersectionality. I'm Dr. Frederick Lee II, emotional intelligence practitioner, executive coach, consultant, and speaker. See, intersectionality is a concept that helps us understand how different parts of a person's identity, like race, gender, and socioeconomic status, interact to shape their experiences. It's not just one factor at play. It's the combination. In my dissertation research, intersectionality was central. And for Black women navigating breast cancer care, the challenge wasn't only about being a cancer patient. It was about being a woman and a Black woman, and often a woman of limited financial means all at once. Each layer added complexity, creating barriers that stacked on top of one another. For example, studies show Black women are more likely to be diagnosed with aggressive subtypes of breast cancer, like triple negative. At the same time, they are less likely to have access to advanced treatments or clinical trials. And layered on top of that are the subtle and not so subtle effects of systemic racism and gender bias. Providers not listening, assumptions being made, pain being minimized. See, intersectionality reveals that you can't separate these struggles. They overlap. Understanding intersectionality gives us a lens to create solutions that are more inclusive, more just, and more effective. When healthcare systems acknowledge intersectionality, they can design services that account for real world complexity. That means offering culturally competent care, ensuring financial navigation, support, and training providers to recognize and address their own biases. And beyond healthcare, intersectionality is a call for empathy. It's a reminder that people don't show up just as one thing. They bring all of who they are into every experience. Here's how you can put intersectionality into action in your own life. Listen more deeply. When someone shares their struggle, ask how other parts of their life, race, gender, income, might be impacting their experience. Challenge assumptions. Don't assume all patients, coworkers, or friends face the same barriers. Support equity initiatives, whether in healthcare, education, or community programs. Back policies that acknowledge and address multiple layers of inequality. In the comments, share this. What's one way you've seen someone's identity affect the way they were treated? Your story can help others recognize hidden barriers. I'm Dr. Frederick Lee II, and this has been your lesson in life.